the 98 Arm Wrestling Podcast. I'm Ryan Grondin. I'm here tonight with my co-host, Josh Vinicor. We have two guests on tonight, Carolyn Von Rader and Dr. Steven Grossinger. He's double certified in neurology and pain management, and they work for RegenOptions.
Thanks for having us. We're excited to be here.
Yeah, thanks for coming on.
Thanks for coming on.
So the question of the day for a lot of arm wrestlers and a lot of strength athletes in general, they hear about it, but what is PRP?
Okay. PRP is a type of regenerative medicine. The term regenerative means that it's a medicine that can help with healing. Sometimes we like to simplify it in saying it's taking your stuff. We draw some of the individual's blood. We put it in a centrifuge that spins to concentrate the healing factors in blood, platelets, other personal kind of chemicals that can help with healing. And once it's concentrated, then it can be injected into areas of need. If there is injury in the shoulder, the elbow, the wrist, other areas of the body, PRP or platelet-rich plasma can be injected to try to help with healing. It has been used in various ways, focusing on the joint itself, ligaments, muscles. It reduces inflammation, it promotes healing. So it is a nice way to try to help a problem without using chemicals such as cortisone type injections, which I've given tons of over the years, and sometimes one will knock things right out. But in a situation where there's an ongoing problem, PRP may be a better choice because it promotes healing.
That's pretty cool. Do you have anything to add, Carolyn?
I completely agree. I think there's two different kinds of patients. There's the patients that come in with acute pain and they want just something to stop the pain, or they give me a steroid shot, all of that. But then there's also the other patients, the athletes, that know that steroid shots, it kind of deteriorates the tissue, and they want long-term factor of healing and getting better, and this is the option. This is the healthy way to go. It's not the easy way, but a true athlete will never take the easy way. If you ever wonder which way Carolyn's going to go, I take the hard road. Whatever the hardest road is, that's the one I take. And so it's a harder road because it's not a quick fix, but it's a fix that's going to actually help and heal. And I was a single mom with two sons, one's 6'7" and one's 6'4". They both played football and basketball, and I would spend my money to make sure that they try to do the PRP before they ever had any kind of surgery. I mean, anything that we could possibly do before it gets to that point. And I say this because talk is cheap, but I've been put back together. I've had 2 neck surgeries and I've had open heart surgery the real way, where the incision goes this way, break the breastbone, go in and do it. So I get pain a lot. I don't take anything for pain medicine. I deal with it, but I go, okay, so you have 2 choices. You can go with, okay, let's stop the pain right now in a synthetic way, or you take the way that, okay, let's heal the body way. And I think that people are gearing more towards that now. They understand that because they want long-term. They want long-term results. They want to be better. And I think, with athletes especially, they know that really, honestly, that's the only way to go, because they're going to have to heal or they're not going to be able to do what they want to do. That's, to me, the bottom line.
That's really cool.
Yeah.
So like when I first heard of PRP, I've heard it through a couple of arm wrestlers and through actually a couple of patients of you guys that they use PRP. Arm wrestling, you guys know this, but it's a very tendon strength sport, and it's a very unnatural movement. Causes a lot of weird injuries, weird pains, that people aren't used to. Especially when they first start arm wrestling, we kind of have a thing we call toothache pain, that throbbing toothache pain. But you put that on your elbow, that's what it feels like. It's the worst. How does, like, so when an arm wrestler comes in, or an athlete that does these kind of odd strength sports, like what do you tell them with PRP? Like, what is it going to do for them? Like, what can they kind of expect out of that?
Well, first of all, when I approach a patient, I get the history and physical, the story and the examination. Was it clear there was, one situation working out or a match when the symptoms started versus it's just something that's kind of gradually come on over time? Does it seem like the problem is in the joint itself? That might be a cartilage related issue. Is it a ligament related issue? Rotator cuff, the elbow has, whether there's tennis elbow, you can get even from arm wrestling. So trying to get a sense for how it happened and where it is. And then once we get a better sense for that, I would get across that PRP is something that can strengthen something. We may want to get a look, it may be necessary to get an x-ray or an MRI or do ultrasound testing to get a look, to get a sense. We want to be sure. I mean, if there's a complete tear or partial tear of something, we want to be aware of that. In a situation where there's a partial tear, which is a very common thing, particularly in athletes who've worked out over time, maybe played sports in high school. There's a lot of stuff that you look for trouble, you tend to find it. And it's nice to have something that can be focused on an area of trouble and with the goal of trying to heal it. And as Carolyn touched on before, there may be the situation where the pain is so significant that it stops you from doing things. It may be something that only comes on, in the midst of competition or in certain maneuvers. Trying to pinpoint the area of trouble, and sometimes it may be that the pain is somewhat vaguer. It may be a muscle group, and the nice thing is that instead of just going one area, I may pepper around and spread to try to help a region like the deltoid that has different heads to it that pull in different directions. But it is a way to try to strengthen things. The body often is content with things being in a painful state, and part of what the PRP does is cause some inflammation, kind of shuffles the deck and reminds the brain and the body that something needs more attention, and part of it is actually delivering some of the helper chemicals to the area, and part of it is to kind of trigger the body's own healing. The same way like you get a black eye and it resolves, or you strain something. But so basically the PRP and stem cells, another, is really maybe in some ways a gold standard, but a little more involved, frankly more expensive and more, just a little more to go through. The nice thing about PRP, which is where we typically will start with someone, it's a simple blood draw, and then we have stuff that we can put to where it's needed.
Cool.
We do both. We're into regenerative medicine, so we start with PRP. There's a lot of people that will say, oh, well, this is absolutely what you need to do, and you should do these in the 3-series way, or I've price checked and did this. I mean, we don't do any of that, honestly. And I've studied what's out there, and the concern, like Stanford, for hair regenerative, 3 times within 30 days. That's the gold standard for why you should have it, why you should sell those, 3 specific times. Other than that, it could work for you the first time, and you don't need another one. And we don't push anything past that. The doctor decides, okay, hey, you're getting some healing in here, and it's working, and we're good.
Generally, we should have an idea within 4, 6, 8 weeks, what kind of response there is, and maybe at that point, you may feel like you're 50% better, 75% better, and may choose to have another one at that point. Sometimes it's just doing that, and then we see in time if something gets tweaked and requires attention. The nice thing is that we can be flexible for the individual's situation.
I think it's also important too. in the past, there's a lot of people that will say, oh, well, I've done this, and regenerative medicine was brand new, and some people didn't have results because of whatever. You have to remember, like, Dr. Steven Gersinger has done thousands and thousands of injections. He could do it with his eyes closed. He could do it by feel, even though we use a fluoro. So to me, in my opinion, if you're going to get an injection, you want it from somebody like that knows exactly where the pain point is, and then gets right in there, and then that's where you want the recovery from. So you can't, like, that's everything to me. So that's why I feel so strongly about it.
That's great.
Yeah, I mean,
We can't have you having a big head though, Doc. I can't tell you how great you are all the time.
it was kind of interesting the first time I talked to you, Carolyn. One of the first things you mentioned is like, I'm not pushy with it. Like, I offer it as a treatment. I know it's going to work, and if it doesn't work, I'll let you know. Like, you're very like transparent with everything, which is it's really cool. Like, it's cool to an office like you guys that has people's best interests.
Yeah, one of my I say my approach is to lay a bunch of things out on the table and help you decide what you want to pick up. And I like to really go from fundamentals of diet, nutrition, even from meditation, how important sleep is, recovery, and you look at the big picture. And sometimes I say I hold up 4 fingers for physical approaches, medication, injection, surgery. It's just like the four directions to go, and each of those can kind of be dissected and frankly have evolved over time. I used to, I think, say medication first, but I definitely think physical approaches, whether it be physical therapy, I kind of divide the physical approaches into, you may go to a physical therapist, a chiropractor, acupuncturist, you may do stuff at home. There's some amazing, YouTube is, great place to learn, exercises, et cetera. It may be using heat, ice, stretching, bracing. So physical approaches. In medicine, I really actually have evolved to really trying to limit medicine. I think when I'm in that mode, I'm more often talking about supplements, things to strengthen the cartilage, chondroitin, glucosamine and chondroitin. Usually if you see something with a joint formula, it's because it has glucosamine and chondroitin, which are basically the building blocks of cartilage, which is really the lubricating and the smooth part of a joint. Versus vitamin B for nerve problems, and omega-3 fatty acids is really important for reducing inflammation and strengthening the insulation, the myelin sheath around nerves. Versus injection wise, there definitely is a role for steroid type injections at some point, and I know myself, I had a shoulder issue and was staring down having a rotator cuff repair about 15 years ago. Got a second opinion and got an injection, and I've been, good since then. So it kind of put out the fire. But in the big picture, and particularly, when someone's an athlete, which entails really, exercising, training steadily, and then peaking for competition, and you have a sense for kind of the tempo of, whether you compete on a monthly basis or quarterly basis, that you may need to build up for things. And, you may know with like your technique from an arm wrestling standpoint that you definitely, your pronator teres, is being kind of stressed as you're trying to do your move. And it might be something that we choose to do, use PRP to try to strengthen, to just give you that little extra, to know that it's kind of can be the best it can be while you're, doing what you want to do. Surgery is always out there, as there are some situations we try to avoid it, but sometimes you got to go that route as well.
It's interesting.
I think one of the important things about our office is we're all passionate about learning, and medical school taught you the basics, but things have changed so much since then. And Stephen and I, and his kids, we're on the audio books, and we read so much about cutting edge information. I actually started a nonprofit, 100% nonprofit, cutting edge options, to help patients go through all the the medical jargon and all of that. But the bottom line is that there's a lot of new information, and we're up on it. and we want to learn. Like right now, my passion is to figure out. So here's what I learned from one of your arm wrestler, well, one of my patients said basically there's a lot of injuries when they try to make a move and it doesn't go well. Okay, that's where the injury happens. And so like I'm fascinated by that right now. Now I can't wait. Like, okay, tell me all the tricky moves, and then I want to know exactly how it goes. And I actually asked him if he would put his arm in. He did. But it was interesting because you could figure out, okay, this is how, this is what happened, and how did you pull back? Then we can help you better. It's not just cut and dry medicine. It can't be. It's different. I just so we care. We're interested in that. Like we talk with that. This is our lunchtime conversation of, okay, what did you find out? Okay, here's what I learned, that kind of thing. And I think that matters. It doesn't matter what doctor you're going to, whatever you're doing. You just need to have somebody that isn't doing the standard and is looking at new things. We're not going to talk about concussion and neuroplasticity, but my point is that there's so much new medicine out there that people, it should be discussed.
Yeah,
Absolutely. So if an arm wrestler walks in the front door and comes in, what can they expect from like the treatment process? Like how long does the treatment take? What kind of results, things like that, like questions they would be asking.
Sure. Yeah. I mean, I always want to get a sense for someone's overall health, just to make sure, are they diabetic? Are they, they have some issue? Are they on medication? Has there been a specific injury? But say once we decide, okay, say we're going to go ahead with PRP, and there are times, where we may same day say, it seems like, you're clear on what you need, what you want. It's kind of sticking out like a sore thumb where your trouble is. And so let's try to put some of your stuff there to try to help it. Then we, drawing blood takes a moment. We have real good people to do that. It takes about a half hour for the blood to be processed, spun down, and then the injection takes a moment. So I mean, typically you'd be in and out. I mean, for a procedure, in about an hour. Though along the way we may talk and try to get the bigger picture to see maybe there is something about your lifestyle that is really impeding your potential for excelling at the sport. You may be working the graveyard shift and getting 2 or 3 hours of sleep a night, and that might be just something that we might just emphasize. You got to work around realities of your life. But so along the way, we hate to overlook something that maybe a factor in your care.
That's great.
it's interesting.
Yeah.
It's like kind of like when an arm wrestler comes in and like has issues. Let's just say they have like an issue on their elbow or on their brachialis or something like that, and it's just pain. It's like radiating down. I mean, would you like say like, all right, like you assess the lifestyle, you assess all that stuff, and I mean, can you go over the 4 different factors that you mentioned earlier? Because I found that very interesting.
Yeah, let me also step back to say, I guess it's not, my background has brought me to an area where I'm, I guess, in a good position to help. I finished my training, my residency. I had gone to medical school in the late 80s. Actually, I did internal medicine, where I was exposed to the range from cardiology to gastroenterology to even surgery rotations. Did that, for a year, and a 3-year internal medicine residency. I was board certified or whatever. Focused just on general medicine. Then I focused on neurology for another 3 years. I grew up in Delaware County. I was at Temple University. Was at Presbyterian Hospital, all in Philadelphia. And then in 2000, I got into pain management, where and now I have 2 board certifications in pain management, which kind of allows me to look at things from different directions. And along the way, actually, I did training in acupuncture as well, because I really wanted to have more tools that didn't, entail just writing a prescription for a pill. But I think as I went through my experience, I kind of came down to like the four things I said: physical approaches, medication, injections, surgery. So as I'm seeing a situation, I try to decide, and I may choose to do nerve testing because sometimes I'm trying to differentiate: is it a pinched nerve issue, or is it a ligament issue, a rotator cuff? Is it coming from the neck, the brachial plexus, like the nerve bundle that goes across the shoulder and really could potentially be at risk? Is it the funny bone, which I say it's not funny, it's not a bone. At the elbow, the ulnar nerve, there's a groove kind of towards on the pinky side that goes down to the fourth and fifth digit. So being a neurologist and being trained in pain management, I can try to sift through and want to be sure we're barking up the right tree. If the problem is a pinched nerve at the elbow, we could give the stem cell to the epicondyle where the muscles attach, and still I say, like, if the problem's in Philadelphia and you focus your attention on Cherry Hill, you're just not going to help the person as much as you like to. So we got to be sure where the issue is. So I luckily the experience that I bring to the table hopefully can pinpoint where the problem is. Then we can say we could do A, B, C, and D. It maybe they come down to rubbing some topical anti-inflammatory, CBD, and other things like that. There are so many options now. But again, it does come down to being as clear as possible. And it may be that that discussing the technique of arm wrestling or working out, it may be that one is just kind of overdoing one thing, and just a modification might allow in the big picture to continue thriving, in your sport.
Yeah. I mean, that's exactly what I was trying to get at.
And I think it's important because it to reiterate the fact that he has to go through these processes to rule out the big things, but he's truly, double board doctor that he knows, let's go through it, make sure. There's places that people go to and they'll go through and somebody will say, oh, okay, these are the big things, but they're not looking at it because they're not, I say real doctors, but that's probably not polite, but that's my point. I always look at it and I tell my team, if it was your mother, that's how you need to treat that person when they walk in the door. That's it. That's the bottom line.
Not that my mother arm wrestles, but she could kick your ass.
Yes, but it could be a big thing that he's ruling out because he's a real doctor. I'm sorry, but I think that makes a big difference in life.
Yeah, for sure.
I think a lot of
my other degree is I have an RFD, which means I'm a real effing doctor.
That's
He's
great.
on my phone
That's
like
the
that.
official
Doesn't
term.
go over so
RFD?
yes, RFD. Yep, that's it.
RFD.
On
We're
my
gonna put
phone,
my
that's exactly
RFD
how he is. I know it doesn't go well over with the chiropractors that we do business with, but I'm just saying.
Some of my best friends are chiropractors.
You're gonna have to delete that.
Yeah, they're
They're
great.
wonderful.
Everyone does their own thing.
Exactly. Everybody does their own thing, and that's exactly. But to me, when it comes to medicine, you got to rule out the big things, because what if it's something major, and you need somebody's brain like that to go through and say, okay, now we've ruled this out. Okay, now let's try healing health. Let's figure out the best way to care for you.
It's like watching an episode of House.
Yes, but you know what? I honestly, I'm not bragging, but my team is awesome. I mean, they're just really nice people. Heather, when you first walk in the door, she's blonde, happy, and I always say that God gave her all my happy juice because I didn't get that. Because she's just always happy. She's like that every day. And then the rest of them, like, they're all like in sync with just really, really good people. Nobody would ever feel uncomfortable coming into our office because everybody takes care of them. There's no mean people. And I always say, I probably can't curse. I don't give a darn if you went to Harvard, but if you're not nice, you can get out. And Stephen will attest to that because that's exactly what I say when I'm hiring somebody.
Oh, that's funny. I feel like you kicked someone out that went to Harvard. That wasn't very nice.
Oh, no. And it doesn't mean that Harvard is not a great school. Oh, wait, I do have an issue with Harvard. So we took a weekend course, and it was brand new nutritional health for pain management, and it was very expensive. And we were there. It was all Harvard stuff, and our degrees didn't say Harvard on it.
Oh,
That's bad.
How messy is that, right?
They'll never sponsor us now.
I drove by Harvard one time. Does that make me smart? I drove by Harvard.
I couldn't believe it. I'm like, where's the Harvard stuff?
Yeah, they totally should give you that.
Yes, Harvard.
Not cool, Harvard.
I know, right?
Maybe they'll watch this.
It was a good course, though. I truly, because it talked about nutrition and pain management, and there's a lot of people that don't realize how food affects your body, and we're just I'm not sure, Stephen, what book we just read, but they simplified it and said basically, and this is like a key thing, and to me, I think these are key things for people to know, that if you eat something and it makes you tired, that's not a good thing for you. If you eat something and you want something sweet afterwards, that's probably not good for your body either. So like, it seems so simplified, but I could tell you the complex version of that, and that I could go on forever. But really, like, that's kind of the bottom line, and and these are all new things.
Well, yeah, I mean, a lot of people say like food is medicine, right? I mean,
Absolutely.
that's what they say.
Yeah.
So
You are what you eat, and also you are what you ate. So you may want to be mindful of even the quality of food. A cow, they say many cows, half their diet is antibiotics, and even like things like jelly beans versus, good old grass, being processed, grass fed, just things like that, which maybe you can't do 24/7 every day, but you're preparing for an event. You might, the week before, you may want to kind of shift things to stuff that's a healthier fuel, and stuff like that. We try to be mindful of.
We do IV therapy too, and sometimes IV just bypasses the gut and goes right into your bloodstream, and that really helps. And it's I think, like, especially like for events like that are very important to you, your team, what you do, to get prepared for it properly, to be coached, like, okay, all right, let's do blood work. Let's see where you're lacking, and we don't push vitamins. We push them, but we don't sell them. And believe me, I have a label all set up that I could sell it and make money, but I refuse to, because I don't want somebody to come into an office and feel like they're being bought. But my point is that we could do a blood panel and look and say, oh, okay, you know what? Here's where you're deficient. Here's the problem. Let's do this. Let's focus on this. Let's get you here. Let's rule out the big stuff, because he's brilliant at that, and get you going.
That's the one thing that makes it quite tough, but
I'm feeling like the background noise. Is anybody else hearing that?
sun stays out to like
a lot of background
much later nowadays.
Doc, are you hearing anything?
It could be. Unfortunately, I'm not home alone.
No, but it sounds like a whole nother conversation.
Okay, it could be my son, Jordan. Okay. Let's keep our conversation going, and then we'll.
Yeah, I can edit all that out.
Yeah.
Anyway.
Oh, cool, good.
yeah, well, but I wanted to ask you, so what else do you guys do at your office besides, we kind of touched on a little bit of it, but besides the PRP, because it's regenerative medicine in general. So let's talk about some of that.
Sure. Often I'll see someone and they may have neck or back pain, maybe spreading to their arms or legs. So I may do testing with EMG and nerve conductions, which basically is a way to test the nerves and muscles to locate a problem. A lot of my treatment approaches involve the spine. I have thoracoscopy. There's what's called a C-arm, because it's a big X-ray that is C-shaped and goes around the table, kind of can be focused on different parts of the spine, and I do epidural injections and other spine injections, which can help to break the cycle of pain spreading from the neck or back. So I will do a consultation, decide what's the best evaluation. Is an MRI necessary? I do ultrasound guided procedures. So try to wrap my head around what is going on, and want to be sure to exclude things. Sometimes I don't have X-ray vision, so we need to whether it be a simple X-ray versus a CAT scan or MRI, different settings. So try to most effectively hone in on what may be an issue. I sometimes use my arm. I say I have the annoying versus scary meter. I want to be always on the lookout for something kind of scary. Is there an infection or a tumor or something, which is rare, but young people occasionally will get something like that, versus annoying, and then the third way the arm goes is the what the heck's going on meter. So we want to try to, factor in there as, make sure it's not scary. It may take patience and just having an approach. Sometimes I might suggest someone put together just a list of simple things from heat, night, ice, stretching, maybe doing, yoga or wearing, doing traction, getting a neck, some kind of device to kind of pull on the neck, possibly an inversion table if there's low back problems, trying to keep things as simple as practical as possible as I try to help people out.
So there's a lot going on. So
we also deal with concussion. We won't get touched. That could be a whole nother podcast, but we deal with concussion. So if there's somebody that has issues or had issues, we focus on that. I mean, I do a lot of that, and I mean, we talk about it. We know, we do testing. We try to help. There's new hope. There's it's not like the old days where, oh, it sucks for you had that. No, like there's great new things that are in concussion. But again, we can touch on that at another time. That could be a whole nother story.
That's a whole other story. It's kind of funny. You mentioned earlier, before the podcast, about how a lot of athletes are stubborn. They'll keep re-injuring themselves because they just don't know how to pull back a little bit, just to let themselves heal. I think that's not kind of an important thing to touch on, because you're really, we're kind of addicted to doing these things, to kind of putting ourselves in these odd positions and, like really hurting.
You're going to do it anyway. I know.
We're going to do it anyway. What would you say to us? I mean,
so then that's when you need you need a strong arm and saying, okay, here's the bottom line. After you're evaluated, you're not going to heal if you don't take the time to heal. It's very simple. And I know you're going to do it. It's really loud, Doc, in your office. I'll let you finish that conversation.
Yeah, just got to say that that trying to give perspective on the big picture, and it may be that there has to be 2-4 weeks of kind of shutting down to allow you to have the rest of the year to be where you can thrive. But we do try to get the big picture together. It may be that I'll recommend a supplement to go kind of heavy on for a couple of weeks or so, just to kind of get things going. I mean, one of the things I'm a fan of in some situation is the carnivore diet, where you literally really focus on all animal products, and even eliminating vegetables for a period of time. And the thing I like about it is reduces inflammation, but I know that there can't be any malnourishment. You're getting all the amino acids and other food groups there. So we try to with our approaches to help direct and give perspective, even though the instinct might be just push with athletes.
But we also understand too, and I say this in a funny way. One of the people that are on our regenerative team deals with Dancing with the Stars, and they put people back together with broken knees and arms and whatever, and get them back out there and help. I know you're going to do that anyway. Like, there's going to be times where we're going to have patients like that, and we'll do our very best to help you get through it as much as you can, properly. I mean, Doc, you want to touch on that? You know
Sorry,
they're
I
gonna
was
do it.
trying to get the background noise settled down a little bit.
Oh, okay.
So maybe just I missed the last word or two.
So there's going to always be the patient that doesn't take the time to heal, and then we're going to have to do our best to patch them up and push them out there and say, okay, here's what we're looking at. This is what you can do. This is what the effects are going to be, and we'll be there to pick up your pieces when you're done. I mean, that's the reality.
One of the things I
anyway.
learned early on, I remember back actually a cancer specialist. He said, as a doctor, you can tell everyone the best things to do for them, but you got to keep human nature in mind. And then he pulled a pack of cigarettes out of his pocket. So I think it's important. I could say, definitely if you do A, B, C, and D, the way I tell you, you'll be in great shape. But I know the reality is that people are people, and it may be that someone is going to keep on, whether it be exercising like a fiend or whatever approach, and I try to factor that in, and I think we, and it may be that establishing a relationship, gaining someone's trust and respect, which Carol, and which our other team members, I think that is one of the things we try to do. I mean, there are some great, I won't say names, but there's some great like orthopedic groups that have 100 orthopedists, and you go there and you're getting extremely well trained people and all, but it's not a connection as much. You feel like you're a number on a conveyor belt,
Exactly.
and no one necessarily is going to remember, that your son's competing to do this, or that your hobby, includes, mountain climbing or whatever. And, I think we try to make that connection, which I think can go a long way. I mean, when it comes to treating pain, I do wonder, I feel like I try to give love or caring in with my injections, and of course for big burly guys it's caring, it's not necessarily love, but I think knowing that actually even one thing, you might come see me and have to wait, and again I'm very mindful of it, but I could see everyone in 5 minutes and never really get past the surface, but when someone's in front of me, they know they have my full attention, and they have our team's full attention. So we
Absolutely.
try to be sure we can use that to the best to try to help people out.
The bottom line is we know you're going to do it anyway, and we're just going to help you through it. That's it, because that's the truth. I have 2 boys. I know that's the deal.
Well, I just want to say, guys, it was a pleasure having you guys on, and I think I learned a lot. I think a lot of people learned a lot, and there's definitely going to be some phone calls for you guys. Where can people find you guys if they need treatment?
Maybe the simplest thing is our website at the moment is Dr. Steven Grossinger, so DrSteven Grossinger, GROSSINGER.com. So drstevengrossinger.com.
Or they can call me directly, and my direct cell is 302-489-9777. So again, that's 302-489-9777. Texting is great because then I can get back to it in case I'm with another patient. But look at me directly. It's my work cell, and it's honestly it's only regenerative medicine, so that's what we do all day.
And we'll put you all the links down below too. And if you guys go on the 98% website, you'll also see a link there too with our sponsor today.
Great. Thanks so much for having us. We really appreciate a chance to talk to you guys, talk to your people.
Thanks for coming on.
I think we should throw out the fact that this is our very first web thing, or whatever you call it, podcast.
Yeah.
So we probably weren't that good at it, but
We're not good at it yet either.
We tried our best though. I tried to practice, it didn't work. Thank you guys so much. It's really
great to
nice
meet you
talking
guys.
with
Look
you.
forward to seeing you.
Thank you. You
Have a
guys
great
take care.
You too. Thanks. Bye-bye.
See you later.
90